Well, it's a good morning. At least the sun is out this morning. My name is Priscilla Regina Naloga. Starting off with the discussions for this Thursday morning, experiences of persons affected by dwarfism is where we're going to be starting from. Dwarfism, of course, is a medical condition. It leads to short stature as a category of disability, and when you get to see world over, people of short stature still face some social, some physical barriers that actually affect their life choices, but also the opportunities that could be out there that they can do and are able to do. And so to talk to us about their experience of survival, I am joined by Joel. And Joel Kawanguzi is the programs manager with Foundation of Persons Affected by Dwarfism. Good morning to you, Mr. Kawanguzi.
Good morning, Naroga.
You're most welcome.
Thank you. I'm very glad to be here.
Okay.
Yeah.
So first, I want to understand from your perspective, what is dwarfism?
Dwarfism is a condition that can make a person to be short. Not only just to be short, but there are other challenges that this person undergoes. One, we normally experience limited cartilage. Cartilage is a chemical, or it is an organ between joints that can allow free joint movement. So at times when we are moving for a longer distance, even just smaller steps, we are unable to walk because the joints cannot. So we normally experience joint pains. Two, especially for our sisters and mothers or persons of short stature, they have problems in giving birth. Their uterus is a bit small to allow the baby to grow. Not everyone, but most. That's why we are promoting selective mothering. Because if I have my money, I can really engage and really buy a certain lady, and they do the implanting and they grow and I become a parent. So that's why we are advocating for subsidizing these issues. Three, still as persons of short stature, we normally have heart problems. Given our short limbs, we do a lot of work during our body movements. So it means we are overusing the heart. So on that one brings heart complications, hypertension, and the others. So those are some of the medical issues as associated to persons of short stature. Then these other ones are the generic negative attitudes. Of course, many feel that I cannot drive because I'm short. No. By the Disability Act of 2012, we are allowed even to bring in vehicles without paying tax. So we need just to tell our people that you need to support this person to be actively engaging into economic activities such that is able to live an independent life.
But ideally, then that puts you in the category of persons with, special abilities, we call them these days.
Yeah.
Right?
Yes.
But then under you both, there are no statistics of your existence and acknowledgement of your existence. And therefore, I trust that it does affect your benefits that you ought to be having as a citizens of Uganda. So let's talk about the statistics. Is there anything that you are relying on to actually benchmark some of the things that could be availed to you?
As we started the organization in 2019, we kept on updating our database. But in addition to that, also someone had done some statistics in 2016, which was estimated at 5,000 persons of short stature. In all those population census exercises that have been taking place, we haven't been captured. Not even us, but also other disabilities. One, even the people at UBOS didn't know what dwarfism is. So in this upcoming population census national census that we are hoping to be in August somewhere, we are engaging actively with UBOS, and at least for this time I need to thank UBOS, especially the director in charge of that. They have already captured, and we are revising those indicators. So this time we are going to be in the exercise. But I appeal to UBOS, let us this time train those data collectors,
the officers,
yes, the officers, to be understanding these disabilities.
Yes.
Because at times they will say, how long can you walk? How this can... So you may find that they have captured a lot of many person disabilities, yet we are not of that number.
Okay.
Yeah.
So if currently UBOS does not have statistics officially about people with dwarfism, then when it comes to the economic empowerment programs, how do you access? Do you even get access as a special group? Well, PDM is here, and it has a percentage that ought to be going to persons with special abilities, but I trust that you're not benefiting from it.
You can just see the face. You know, in districts where at least they understand that we are part of the disability group, they only tell us that you got your senteza mwezabale majezili, you go for your funds for persons with disabilities. But for them not knowing that, yes, they are special grants for person with disabilities, but they were being brought to ensure that they can enhance the economic participation of person disability, but it doesn't limit us from participating like in women emancipation program, youth lively program, NTVUganda, and the others.
All right. So
really there is limited participation, and I appeal especially to the district people, especially the CDO, that please let us also allow persons of short stature to participate.
So as you have engaged with UBOS, are you having any active engagements as the foundation to have that recognition also in as a special group in the government aided programs? Yes,
for example, under NTVUganda, we are in engagements with the Microfinance Support Center. Recently, we just registered a national circle for persons of short stature, and they are now saving, and we hope, and I appeal to Microfinance Support Center that please, it's time. We are already saving, we are waiting for your funds to help us get more loans to ensure that we can do more businesses other than going now to the bank or what they normally ask endless needs that we cannot afford.
Okay. Mr. Kawanguzi, there's also the recently concluded research on the sexual reproductive health. In regards to that, what are the key findings that would be of challenge to people with a short stature in Uganda?
Quick one, HIV and AIDS is really crucial. Many people feel that when you have sex with a person of short stature, you can get healed. Where you are in Kampala,
you can get healed.
Yes.
That's a myth, that if I have HIV AIDS and I have sex with a short person, I get healed.
Where you are in Kampala, it is different in those villages. Okay. Really, even having a kid, you know, just going to the health center. One time I took my wife for antenatal. It was in Iganga National Hospital. Then I found there were many ladies. Then I said, were these ones being impregnated by the Holy Spirit? Because I was the only man. Now when they saw me, they took my wife, did the HIV testing alone. Then I said, but you normally say couple testing.
That's the campaign that they run.
Yes, why? They said, for you it is okay. You see that? Assuming my wife was positive, and by that time I was negative, and I'm not informed, wouldn't affect me and contract the virus. So you can understand it. Three, another thing is giving birth. As I told you that we need specialized antenatal care given our short limbs. Our mothers normally experience pain. even it is very hard for them to deliver normally. Most of them who can afford
to the whole entire 9 months term.
Yes, they can undergo cesarean section.
Okay.
But not in every hospital. So for this one, really you can understand the scaffold that really we need the engagements. Even accessing these sexual reproductive health services, just speak about family planning. People, anyway, they don't believe that we give birth, so why that we can have sexual family planning methods? So you can understand how we are really affected. But nonetheless, there are some health workers that have come out, like in Kasese, we have engaged the district health worker. He's a very good man, and he has really accepted and he trained fellow health workers to ensure that the person is of short stature receive adequate services to ensure them that they can. Then still under our program for sexual reproductive health, we are doing savings and credit. We organize these people into groups such that they can access small loans. If you feel sick or you want to go for your family planning method, especially you don't have transport, you can get some loan, go get that injection or any plant, then you pay later.
In installments.
Yes.
Okay, allow me to interrogate the HIV/AIDS situation that you did mention. While the myth is true in rural places that if you want to get healed of HIV/AIDS, just have intercourse with a person of short stature. But then there are some statistics that do indicate that there's a rising scourge in terms of HIV and AIDS among people of short stature. So could you help me understand what could be leading to this in regards to
the increasing rates?
Yeah.
You know, people love us, not love, but they want to have sex with us in the dark. Today, you might want me because I might be better than your husband, but you may not want the whole community to know that I'm your husband. So, and in your thinking, you may be thinking that you are the only one who is sleeping with me, not knowing that there are so many who are sleeping with me. The way how you want to keep me, to keep me in the dark, is the same way that you will not allow to take me to go for HIV testing.
Oh.
You understand that?
Yes, no.
So you only come at night, you have something, you go. Also the other, so I can become a center of HIV. So we cannot achieve...
Become a distributing company.
Yes. You know, we cannot achieve the cascade model 95-95 of ending HIV if persons of short stature are left. 3, we are speaking about adherence on the treatment. It is horrible if the community really discriminates you because you may not take your taps when people are there. So at times, other days you skip, and this one provides an opportunity to the virus to manufacture and to be so active. So by the time someone comes, you are like a transformer. Anything with this, you just take it with your HIV. But I encourage our persons of short stature, even the whole group, to ensure that they go for testing, but not these things. One, there is PEP, post-exposure prophylaxis. If you know that you went with Flavia and you didn't know the status of Flavia, maybe Flavia didn't allow to go for testing, but you already had the sex, go for PEP. PEP are HIV drugs that works within 72 hours. So the earlier, the better. And also ensure that really there is no scaffold in sex, because that's one avoids corrosion or ensuring that there is blood contamination. Then another thing is about PrEP. Those PrEP are tabs, ARVs that you can use, especially if your partner is positive and you are negative.
Okay. Yeah. All right. Let's talk about other spheres, for example, education. In terms of raising awareness to communities, to schools, to parents, to those who aid in community welfare and well-being. Are there campaigns that you have had in that regard?
Yes, but
what have been the responses of people?
Yes, but there is just a scenario I'm remembering.
Tell me about that scenario.
When I was joining P1 Higelera Primary School in Namutumba. During those days, remember now, these days they will tell you interview. For us, our interview was to touch the opposite ear. But remember, the limbs are short.
Oh, yes.
You can just view my head is long. Someone is telling me you touch, so you try, so you may end up making 35 years that you can't touch your ear. So that one would stop us from joining P1.
That would be something they would use to stop
automatically
people with dwarfism to join school?
Yes, it wasn't only dwarfism, it was the whole, but what it stopped us, it is, I might be 35, even 8 years without touching my opposite ear. So that one really...
One wonders how that relates to education, you receiving education. Yes.
So that one really stopped many persons of short stature from joining education, attaining education, that stigma. But as foundational persons affected by dwarfism, we are doing sensitization. For example, now we are in talks, we are working closely with the LC5 Iganga. Gabula is a person of short stature. Really, it has helped us. There is now Salah Short, I think you remember Salah Short, and really it is an appeal to, especially to the musicians. Please understand, like Salah Short maybe didn't know about that overworking because of the limited cartridge in the joint. It may affect the joints, and now I think is now on a wheelchair. So for my persons of short stature, let us ensure that. Then also we are working closely with the government vocational institutions like Chileka, Reza, Impomode, Luti in Ntungamo, to ensure that they can take up persons of short stature. So in short, those are some of the key things that we are looking at.
What has been the response, however? You have done your part.
Yes.
But what has been the response? Has it been delayed response, positive response, negative response, no response at all?
Of course, as I speak, we have, for this year, we have enabled at least 15 persons of short stature to join. But where there is a negative response is especially for the parents. They still don't believe that really their children can. And I wonder, you may find that I might be Flavia with you here saying dwarfism is this, let us do. But when you go back at home, you are hiding your child. You don't want Higenyi to see that you have a child with disability. So you can see that. But also another thing is about physical inaccessibility. As I told you, our limbs are short. You find that at schools, just opening the door, the locker is up, it's on your head. It's the same thing that really is affecting us in accessing some of the financial services. I don't know whether the ATM machine for Centenary Bank in where in Bushenyi, after Bushenyi, which town is that? I went to withdraw money. The ATM machine was just on my head. Then when I went to the bank, telling them that please, I can't. Then they tell me, go to the guard to help you. But you don't know the guard might even have slept.
Yes.
No, at least,
you can't trust the guard with your PIN because you don't know what will happen there.
Even the person in the bank.
That's true.
Yes, because being person with disability doesn't mean that I'm poor. Because I might be withdrawing money which you have never withdrawn. So what we are looking at is let us have an inclusive environment where everyone can independently, sufficiently access the services and support other persons.
Mr. Kawangozi,
yes.
In all of this, there's perceptions of different people, and I know that it entangles itself with the inferiority complex that
yes.
Persons with dwarfism actually will experience over the course of time. And you have talked about the challenge of the parent having that child with dwarfism and not even considering giving them an education because of that condition. How much more is it challenging for example, yourself or those that are adults today in finding success, in finding a livelihood, in getting employment, or even creating employment for that matter?
I can give you a certain scenario. I think it's not really only finding employment, but also having peace of mind. As I told you, you may be even being there, you have your property, but even your wife doesn't respect you. It's like a fight, because when you come to marry me, you may think that this Joe, I'm going to overpower him. So the whole marriage will be who is who is who.
Yeah.
But coming back at your question is really challenging. One, these adults have been unable to attain education. You can just believe. Three,
so the illiteracy levels are high.
yes.
Okay.
Two, even their parents have never given them land as children. Those ones,
inheritance.
yes, inheritance.
Okay.
Those ones who have managed and their parents have passed on, their siblings are fighting for that. Another point, making decision in the home. They only love you when you have the money. They come to you because they want something, but not allowing you to make a decision as Joel, but because of the resources that you have.
Joel has some money.
Yes. But I appeal to the general person with disabilities that let us not fight, let us be humble. These people are doing it out of ignorance. Some of us have undergone such challenges, but because our parents were ignorant, and let us sensitize them, let us leave examples, because fighting, it may not help us.
Mr. Kawangozi, from your own personal experience, what has been the hardest challenge that has hit you because of this situation?
As a person, I think it is about HIV and AIDS, because you might have a partner who has come to you. In your mind, you know that she loves you, but in her mind it's because of the property. So in that case, we will be having another partner. It is better to be poor when you are healthy than when you are poor, but when you are sick. So many of my colleagues have undergone such situations, but at times, with the exposure and other things, I've seen so many non-disabled persons undergoing the same. So kindly, persons of short stature and the general public, or the general person of disabilities, let us make it hard. We are not alone.
Okay. Let's talk about the foundation of persons affected with dwarfism. You say that you are now in a number of regions.
Yes.
In terms of perception, reception, and the programs that you run, how are, first of all, persons with dwarfism themselves, are they acknowledging and embracing these programs?
Automatically, because in most of the areas, it is a new thing.
Which areas are you in right now?
Currently, we are in Busoga sub-region. We are in Langi. We are in Central. and we are in Rwenzori. And this year we are going to Karamoja sub-region, we are going to Sebei, Bugisu and Ankole. So back on the other question, it is a new thing because we just started in 2019. So you can understand that many persons of short stature who have been kept inside. There is one girl in Chankwanz whom we rescued from the grandparents. They were keeping her, you know, that protective parenting, doing this, doing this.
Protective parenting or hiding because of the shame? Those are two different things.
Now these ones were two. There was protective parenting, but also hiding the shame. But back on the protective parenting to our dear parents, however much you hide, you keep your daughter or your son, this person has to undergo these changes as any other normal person. So to avoid other things that may work out, let us keep them like other children. So like when we went to Acholi, we were able to mobilize over 50 persons of short stature, and they made a regional committee. This regional committee acts as information centers. They act as referral centers, and they can reach us where need be. Okay. So they were very happy of what, because I have been only hearing about the albino, cerebral palsy, physical disability, the blind. So this time we also went. Okay. So they are very glad to receive.
All right, Mr. Kawanguzi, where is the government failing you?
One is statistics, because we can't do anything
unless there's
because statistics. Even if we are writing to the donor, they want that. Two, the limited capacity of their officers to effectively engage persons of short stature. It is by design that they exclude us. You find that it is a community sensitization program on HIV, but there is a big crowd. Really, Flavia, do you really manage to penetrate into that crowd and go in front to be able to see, but also to hear? So then, you know, when our mothers maybe have gone for getting mosquito nets, they normally make us into lines. Musimbe line. And for you are like a kid. They are not seeing you. They say Disibalaba. Yeah, and some of us, our faces are too small. Yeah. So that's where the government is failing. Three, we need the attention. We need, wherever we are, we need to have meetings with our leaders, at least to listen to us, to be able to be part in the planning process. They shouldn't really plan for us. They shouldn't think for us. We also now, at least, with a few who have access to education, we can do programming, we can do planning, we can do data collection. So let us be part and parcel of these engagements.
Okay. What can be done to improve your social stature, especially when it comes to the communities that people affected with dwarfism hail from? In conclusion.
In conclusion, one, we shouldn't forget about having a specialist to assess dwarfism at an early stage. You know, the earlier, the better. It can inform the parent to say, hey, this child will undergo this and this. And from time A, you know what to be done. Two, in our communities, is to ensure that we sensitize them to understand that really persons of short stature exist. They are like this. These are their weaknesses, but they also have the strength. Three, is to ensure especially access to wash, water and sanitation. You know you can't live without water. But you find that our boreholes, really pumping them, they are low, yeah, and they are very heavy, so it is very hard for
which
me.
overworks your heart. Yes.
You go to our toilets at schools, for example, the holes are big. You know, we have limited short limbs. Squatting, it's really hard for us. 4 is to ensure that we are part and parcel of these development activities, such that, you know, government is looking for taxes to do ABCD.
And you can contribute to
we
the tax
can.
base. Yes,
Yes, we can.
Yes.
So those are some of the things real that we can do.
Okay.
Yeah.
All right. It's been a pleasure having this discussion with you, Mr. Joel Kawanguzi, Programs Manager, Foundation of Persons Affected by Dwarfism. That brings us to the end of our Tech Note this